back to my channel. My name is Kwan and I'm a third year optometry student. Today's video is going to be a day in the life of an optometry student. It is a Sunday, so I'm going to show you what I do to prepare for Monday and the rest of the week. On today's agenda, I have boards prep. I have to prepare for my online clinic, which is a didactics that we do for ocular disease on Mondays. And then on Monday as well, I have a ocular pathology exam. So we'll go ahead and get that all knocked out and I'll show you how I approach my day. Let's get started. For breakfast, I have my latte and a cinnamon roll from Cinnabon. And I'm gonna watch some YouTube videos or maybe Wizards of Waverly Place while I eat my breakfast because I really don't like to do work while I'm enjoying my morning. Alright, so I'm finished with my breakfast. So now I'm going to do my boards prep Anki review cards. Today I have 29 new cards and about 160 review cards. So I'm gonna go ahead and try to get this done in the next hour or so, and then we'll move on. So something cool that you can get on your laptop to help you focus better is this Pomodoro style Focus City. So it's literally $1 or maybe $2 max, and you get to set your timer on how long you want to focus. And when you start building and you try to go on Facebook, YouTube, or anything like that, it'll completely block it for you. Hey guys, so I finished with my Anki card and now I'm going to be working on my patient presentation for ocular disease didactics tomorrow. So how it worked is that we are in a group of 5 students and 1 attending, and we all have 1 case to look over, and we just talk about the case, the patient findings, and all that stuff. And so I thought it'd be fun to do it with you guys to see what it's like to prepare for a didactic case. I'm just gonna go through my patient chart, and of course their names are all wiped out, so we're not violating any HIPAA violations. And I will be right back in 20 minutes so I can share it with you guys. So I'm back, but I'm gonna go ahead and show you how I would present this patient in clinic. But first, I wanted to give you guys a little background on the patient. So he is a 22-year-old African-American male that complains of pain, redness, and blurry vision in his right eye that developed about 2 to 3 weeks ago when he got hit with a screwdriver while working on his car. It didn't cause any bleeding or swelling, but a few days after he got hit, he developed a bump on his eye that was red. So what he did was he went to the PCP and they said it was just a pink eye, so they gave him antibiotic drops and ointments. So he used that, but afterwards the symptoms got worse. So for the past 6 visits that the patient has came for, his symptoms did improve. He did get better. So today's presentation, how I would present to my attending would be, I have a 22-year-old African-American male presenting for a doctor-ordered uveitis follow-up in his right eye. The patient denied any light sensitivity, pain, aching, discharge, and redness last visit and was compliant with his Pred Forte medication, but he did not get atropine filled. His vision has improved to 20/20-2, and his pressures were 12 millimeters mercury on both eyes. His preliminary examinations had no significant findings. Anterior seg exam showed a grade 1 cell and flare in the anterior chamber, and the majority of the posterior synechiae was broken. Posterior seg exam showed no hemorrhages, exudates, and a grade 1 cell in the vitreous. Usually after we present, we give our attending a differential diagnosis list of what we think it could be, but because my patient is an established patient, we already diagnosed him. Then we would tell our attendings how we would approach the exam. So some case history questions that I would ask today for his visit would be, vision, is he experiencing any light sensitivity, pain, discharge, or redness, and how he's using his medication, and if he did get his atropine filled. After that, we'd tell him how we would approach the exam, which, I would check vision, I would check his pupils, I would check his extraocular muscles, confrontation visual field to see if there's any peripheral vision loss whatsoever, check his pressure, check his anterior segment, and then his posterior segment after dilation. So yeah, that's pretty much it that I would present to my attending. And then we would just talk about the patient as a group and different ways that we can approach it, or different diagnoses and all that stuff. So we'll go more into depth with the attending. but right now this is what I would present. So it is noon right now, and I'm gonna go ahead and throw the trash away. And while I do that, I think I'm gonna go for a little walk outside. Usually I don't do this because it's 100 degrees in Houston, but today in particular it's only around 80s, and so you know what, might as well enjoy a little bit of outdoors because I've been sitting in the same chair for the past few hours. Also guys, remember to always lock your door when you go throw the trash away, because you don't know who's going to run into your apartment when you do that, and you should always stay safe. I was gonna make lunch, but then my friend Nadine was like, do you want to go get McDonald's instead? And I said yes, of course. And so now I'm gonna go get McDonald's. We got the goods. Hi guys, I just got back to my apartment. Nadine and I went to McDonald's because we haven't had it in a while and we were craving it a lot. And we watched a little bit of Shark Tank, but now I'm back to my apartment. I'm gonna watch a little bit of Disney Plus and just relax for a bit, and then I'll start studying again around 2:30 or 3. So usually I would be studying a lot harder for the exam and I wouldn't be so relaxed like I am right now. But I'm the note taker for ocular pathology. So a note taker is a person who goes to every lecture, takes notes, understands material, and condense them into a document so that the class can use to study. And so because I've been doing that and keeping up with the material and making all these notes, I feel like I have a good grasp and understanding of the material. So since tomorrow is the exam, I feel a little less stressed about it. But it is 3, so I'm gonna be studying from 3 to about 8, and then I'll catch you guys up with what's next. I'm just gonna have dinner. I have my water and some leftover pasta that I made. Okay, the weather is so bipolar. It was literally raining so badly just 5 minutes ago, and then I put my camera out and look, sunshine. What? Alright guys, it is 11 o'clock and I'm probably gonna go to sleep because I have to wake up at 7:30 tomorrow for my didactics. So I'm gonna go ahead and go. I hope you guys enjoyed the video. Go ahead and like it, comment, subscribe, and follow me on Instagram. Bye!